Still talking about blood transfusions, this is the second section in which we'll talk about the indications for blood transfusions. We'll see what are the various reasons for which the blood transfusion has to be done. We'll see what are the important triggers that require blood transfusions. And we'll see what are the preoperative blood transfusion criteria. So let's get into the details and see what happened. So in the figure you can see this is a caregiver. This is a pint of blood that is being transfused through an IV cannula into a patient. This is a blood bag. This is the patient. So this is how the blood transfusion is usually done. So indications, what are the indications? The first indication is acute blood loss. So obviously, if a patient is undergoing acute blood loss, you first plug the bleeding in, then you try to recompensate for that blood loss by donating blood, by transfusing blood to that patient. This blood, it replaces the circulating volume that has been lost due to hemorrhage. It maintains the optimum oxygen delivery. Then the perioperative anemia. So perioperative anemia is treated by blood transfusion. That is the anemia that develops during the operative procedure. This is done to ensure adequate oxygen delivery during the perioperative phase. So you are performing a surgical procedure, and during that a lot of blood has been lost. Now the blood is the only medium through which oxygen is transferred to the entirety of the body. So you need to make sure that the sufficient amount of blood is there in the body so that it can transfer oxygen to the entirety of the body. So during your surgical procedure, you might transfuse your patient with blood. Now, another indication for a transfusion of blood is symptomatic chronic anemia. So you have patient that has chronic anemia. The patient is weak, the patient is emaciated, but now the patient has developed symptoms. So symptomatic chronic anemia, even without hemorrhage or impending surgery, requires a blood transfusion, because the body has been anemic for so long that it cannot compensate for it anymore. So now you have to transfuse blood to your patient so that your patient might survive this ordeal. So what are the various triggers? Historically, HB less than 10 used to be the trigger for a physician. So whenever a physician found in hemoglobin levels less than 10, it was recommended to transfuse the patient with blood. The level of HB up to HB 10 was considered the safe and optimum level. Now this has been shown to be unnecessary. Now there's a lot of debate on whether a patient with HB 10, a patient with HB 10 who is not actively bleeding, who does not require surgery, does that patient require transfusion? The answer to this is no, that patient does not. You need to improve the diet of that patient so that the patient might form sufficient blood cells and the hemoglobin level of that patient might rise. It is a time-taking process, but the patient is in no emergency. The patient is all right. The patient only has low HB. So you improve the diet and the HB of your patient will improve as well. So this is now what is being debated. It is also associated with increased morbidity and mortality. However, a level of HB 10 is associated with increased morbidity and mortality. So HB 10 has some basis to it. However, it is not being commonly used now. So hemoglobin of 6 gram per deciliter is acceptable. So if a patient is stable with a hemoglobin of 6 grams per deciliter, that is also acceptable. So the level of 10 gram per deciliter does not hold that much now. If a patient at 6 gram per deciliter is all right, the patient is showing no symptoms, the patient is recovering, the patient is better, so that is not an indication for transfusion. Now, this patient should not be actively bleeding. The patient at 6 gram per deciliter of hemoglobin should not be actively bleeding, should not about to be to undergo any surgical procedure, and should not be symptomatic. So the criteria for a patient with 6 gram per deciliter HB and being considered all right and being considered not a candidate for blood transfusion is that the patient must not have any symptoms, the patient must not have an impending surgery, and the patient must not be active bleeding. So if this criteria has been fulfilled, a patient with 6 gram of hemoglobin should be, the diet of such a patient should be improved to the extent that the hemoglobin of that patient should be improved with the passage of time. Now, the optimum HB levels in some of the patient groups is very, very controversial. So, for example, the patients with cardiovascular risks. So, these patients are already at a lot of risk. Whatever the cardiovascular pathology might be, these patients cannot compensate, the bodies of these patients cannot compensate for very low levels of hemoglobin. In a patient with cardiovascular disease, a 6 hemoglobin might be a death sentence. So you need to consider, you need to take into account the special considerations in all the patients. A patient with a cardiovascular background should have sufficient hemoglobin so that the body does not go into a frenzy. The body should be able to compensate for it, and you should avoid low HB in these patients. Similarly, in patients with sepsis, patients who have undergone sepsis, now the body is already fighting bacteria throughout its entirety. Now the body is fighting either throughout the entirety or at this specific focus, but the body is in a state of fight. The body is in a state of war. The body is already under stress. So this patient cannot undergo a fall in HB because this patient is already giving whatever he has to the fight. So you have to maintain your HB in such patients. Now, in patients with traumatic brain injuries, again, it's the same condition. There has been a traumatic brain injury, and the brain has to recover. The brain requires a lot of oxygen and a lot of glucose. The HB level of this patient cannot fall at all. So these are some of the categories or some of the considerations you should have in all of your patients. So whatever decisions you might make depends upon the circumstances of your specific patient, and with that you decide whether your patient requires a transfusion or not. Now, higher HB, it improves oxygen delivery. In theory, yes, it does. In theory, greater the amount of hemoglobin in the blood, greater the oxygen delivery. Now, what is the criteria for the transfusion of blood? We have not gotten to the ABO system or the RH system yet. However, this is a slight window into how we transfuse blood to various patients. So this is the phenotype of the blood. That is the type that is written on the blood bag. Blood can be either O, A, B or AB. This is according to the ABO system. So this type is written on the blood bag. This is what the genotype or the gene complement is. In the in phenotype O, you can have you have both the O alleles. In phenotype A, you can have either AA or AO. In phenotype B, you can either have BB, that is both the dominant B alleles, or BO. And in AB, you have one A allele and one B allele. As a result, you have both the A and B. Now, in O, we have the antigen O. As a result of the presence of antigen O, we have antibodies against A and B. These are the anti-A antibodies and anti-B antibodies. So in A we have anti-B antibodies, in B we have anti-A antibodies, and in AB, since both the antigens are there, so there are no antibodies in the body. Now we try to match this blood type with the blood type of the patient, and then we transfuse the patient. This O is the universal donor and AB is the universal recipients, because AP does not have any antibodies and O does not have any antigens. So AB the universal recipient, O the universal donor. The frequency of these blood types, O is 46%, the blood type A is 42%, B is 9%, and AB is 3%. So this is the frequency of these blood types. So with that, we get an idea of how to transfuse blood to various patients and how to cross-match it. So this was all about this section. I hope you liked and enjoyed it. For further sections, keep watching sqadia.com.